This is Dr. Albert Chelfian, the Endoscopic Spine Institute in New York, explaining why you might not need a cervical fusion. So most patients are having anterior cervical discectomy and fusion procedures to unpinch the nerves in their spine. Now, this is the front of the spine. You can see the vertebral bodies and the discs in between. Now, the spine is a canal. So the tube, the spinal cord, goes down the center and out the sides come the nerves. So when a surgeon does a cervical discectomy and a fusion, he's removing the disc, he or she is removing the disc, looking down with a microscope and unpinching the spinal cord and the nerves from the front, and then leaving in a spacer and screws for this to fuse. Now, it's a very successful operation, but the problem with it is it reduces the flexibility or motion of that cervical level. So, and that could put stress on the other levels, which is adjacent segment disease. So at the Endoscopic Spine Institute in New York, we're trying to avoid putting in implants and try to preserve motion, right? So we're able to go in from the back and shave a little window through a tube the size of a number 2 pencil and unpinch the nerves, and if we need to, unpinch the spinal cord. So we have patients who are professional athletes, NFL players, UFC athletes who come to New York to avoid a spine fusion. So this is just to let patients all over know that if you're looking for a minimally invasive non-spine fusion alternative, you can consider endoscopic spine surgery.